What's going on, y'all? Kevin Kuhn here from Athlete Factors. This is the Athlete Factors podcast. I'm here with Dr. Ron Tribendis. How we doing, Doc?
Good, man. Hey, you said that name perfectly the first time, huh? Did you have to practice at all?
No.
You didn't practice the intro at all? You just went right to it, sounded it out.
I'm like 18 episodes in. I just figured just wing it, and if I get a name wrong,
I gotta go back and listen to the first two, because those are always the worst, man. Worst. But thank you for having me, man. Thank you for having me, man. I really appreciate it. I hope we can deliver some good content so everybody can get something out of this.
No, I think we will. I think your emphasis on like practical info, like especially with regards to what you post on Instagram, I think is great. I love that. I just saw the post that you just put up with triathlete runner, something like that.
Yes.
He's just overstriding a little bit on that right leg. Like really awesome pictures. You're showing shin angles and.
But I think that goes right into what you do, as far as a movement specialist too. So I think if we can kind of talk a little bit about that, I think people like that, enjoy that.
Sweet.
Of course, they like all the sexy Instagram pictures, but those are the ones that get all the likes. But the line drawings that get likes from you and I, we'll at least have two, me and you on that post, right?
I already liked it. So
see, there you go. All right, I already got one check for the Instagram post today.
So you're my first chiropractor.
Mm-hmm.
So I've just being in the industry, there's such a people either have really good experiences or tend to have really bad experiences. And there's really good and bad people in every profession, but for whatever reason, there's, there kind of tends to be this whole idea that chiropractors are quacks. Right. So if you just give us kind of the basic rundown on both your athletic and your academic background, mm-hmm. and maybe a little bit about why you think that idea is relatively prevalent and what you do to kind of combat that, if you will.
Yeah. I mean, I have a lot of good information on that because I really believe strongly in what you just said. I mean, I could explain a lot of what kind of what I explain to patients too, but my background, started in athletics. I played basketball and baseball. I went and got my undergrad. I was an athletic trainer by trade. I mean, that was my degrees in health sciences with a minor in biology and chemistry. And then I decided to go to chiropractic school. I was all well intended to become a surgeon, but that lifestyle I didn't really want at the time. And, it just seemed like I was able to, with chiropractic, as that avenue, I was able to kind of start a business. I like to be entrepreneurship. So, mm-hmm. It really allowed me to kind of go out on my own and make it what I wanted it to be. Right. So it was a degree that I was able to go, accomplish. It was hard schooling. I mean, it's the same as medical school for the first couple of years. And then you kind of just transition off into more of a manipulation and what you really would regard as what true chiropractic is. Right. Mm-hmm. But coming from my sports background, I felt like there was so much more, and I've been doing this now for about 14 years. About 7 years ago, my business partner and I founded Performance Medicine and Sports Therapy. And it was our intent to make more of a multidisciplinary approach. I really think that the outcomes that patients can get are so beneficial from every profession. Right? Not just chiropractic, right? But I think we'll get into that, but I think the question you asked is, why is that reputation of being a quack in this sense? Well, I think you can get the used car salesman approach. Mm-hmm. It's kind of like that whole philosophy of, yeah, sure, you get adjusted, it feels good, right? I mean, it sets off endorphins, it helps you feel better, but you're not really, in my opinion, you're not really fixing anything. Right? Mm-hmm. You're not fixing movement, right? And the true sense of chiropractic and the true definition of it is that, joints become fixated, they get released, and it should fix everything, right? Well, in my experience of dealing with, NFL athletes, professional athletes, even general public, is that more problems come from movement dysfunction, muscle dysfunction, that end up fixating a joint. So the other way around, mm-hmm. Meaning that you have some kind of movement flaw that either, overactivates a muscle, then that bully or that facilitated muscle then inhibits other muscles, that changes gait pattern, that then ends up causing pain. And the way I look at it, then a joint is in response to that. A joint is going to get stuck because it senses that instability in the system, right? Mm-hmm. So, I kind of look at it that way, and that's how I explain it to my patients. That's just my view on it, right? You're going to get traditional chiropractors, they're going to be like, this guy's nuts, right? You get it from the other side. They're going to hate me. Maybe that's why I don't have too many chiropractor friends. I don't know. No, but I believe in what they do. I believe that it gives some relief, but I was looking for more answers, and that was just me. That was my personal take on it and just what I was seeing in my clinic, right? So, that's kind of how I explain it to patients, and at least my view on it.
Gotcha. That jives pretty consistently with what I know, or what I think I know anyway, what I've learned. And like, the human body is so complex, right? There's all of these systems that in school we learn separately. We learn kind of they're compartmentalized. But when it comes to three-dimensional movement, when it comes to athletic movement, when it comes to just activities of daily living, just being a human, you can't separate them all out. Like, we generate leverage by utilizing muscles attached to tendons that are attached to bones, and bones are attached to other bones via ligaments, and like, everything's got to be able to work together. And I think you're doing not only yourself a disservice, but your clients or patients a disservice if you're fixating on one specific system.
Right, and that's the same. That goes for any profession too. That could be a physical therapist. That could be anything, right? I really believe it should be treated as a whole, and that's one of the best books that like really hit home that point to me when I read it. And it kind of reads like a textbook, but is Anatomy Trains by Thomas Myers. Yeah. Probably one of the coolest books just to explain how everything's really connected, And I know there's still studies being out that if he's 100% correct on certain things, but it just makes so much sense to me. It really hit me to be like, wow, all this is connected. There's not just one philosophy that's going to fix everything. And I think that's what then started me on the path of trying to pick up as many tools from my toolbox as possible, right? That's kind of the one thing that I always go over with my patients when they come in, anybody really, is that you can have physical therapy, chiropractic, cupping, rolfing, dry needling, and I can go on and on and on, ART, anything you've ever heard of. They're all great. They all fix things, but put them in a bucket. They're all modalities, right? If you don't find out the why, then you're not going to fix anything. It's just going to be feel good. But if you find the why, you could use any of those things to fix the problem. So that's the thing when people get on their high horse about their technique is the best, it's going to fix everything. That's bullshit. It's not going to work like that, And so if you separate it out like that and able to find that why in the system, and that's kind of what on my content, on my personal page, I'm always pushing that. I mean, that's even in life, right? I mean, you got to find, if you're going to start a business,
what's your why?
What's your why, right? Simon Sinek, that's a great book. And you asked me, it's a question for later, but that's one of the best books I read once a year is Find Your Why, because it changes every year. It helps you, your why helps you find your purpose, helps find what you're going to do. And at the end of the day, that can be applied to the body, right? The patient comes into you and they're like, you're looking and analyzing, doing everything you know to do to find the why, or the why of the problem, or why they're in this way that they are. And then you administer whatever tools you have in your toolbox. And guess what? If you can't fix it, you find somebody that can. You do them that service of being like, man, it's out of my scope. Now I need to find somebody else. So.
Yeah, that actually is a perfect part to mention that there's a client that I have. I've worked with him for a long time. He was running marathons, trained him, essentially like some strength training and performance
training. Don't get his ego so big. You can't give him a shout out. Because you're going to tell him to listen to this, and then you're going to tell him he's going to be wrong. You talked about me on Kevin's podcast, and he's going to get a big head, and now I'm going to have to deal with it. So
well, I already checked to make sure it was okay with him.
You actually checked. There you go. That HIPAA compliance on that, right?
Exactly.
But good. Now here's the thing, though. Now you can test him to make sure that he actually listens, right? You're like, Hey, you listening? But anyway, go ahead. Sorry about that.
No,
I just knew where you were going with that.
So, yeah, it was one of those things where I was like, you know what? I was getting to a point where I felt like I was kind of stalling. I was like, I still think I know what's going on, but I'm now to a point where maybe there's other modalities that would be super beneficial. And those modalities I don't have experience with.
Mm-hmm.
So it was at that point that I reached out to you and I was like, hey, Ron, I've got a guy, need another set of eyes on. Can you take a look? And I think we've been able to do a really good job of like still continuing to work with him. And I still see him about once a week or so. And I think y'all are seeing him about the same. And
well, let's use this as an example.
Complimentary.
Right. And here, let's use this as an example because it makes sense because he's been through a lot of stuff, right? So if we use this patient as an example of how a patient can be moved around, from provider to provider. I'm going to be referencing a lot of books because it's kind of like I have my top 8 of how I kind of do things, right? So, in Sue Falzoni's book, Bridging the Gap, right? I have it right over here. Let me look at this right here. You ever see this one? It's called Bridging the Gap from Rehab to Performance, right? Mm-hmm. So she writes in there, and it's really great because it really shows how there should be a different leader of your treatment at different times of your rehab process. So let's use him, for example. You were kind of got to a point where you're like hit a plateau. Well, then he ended up rupturing. We're not going to go into it all, but he ended up rupturing his Achilles tendon. Mm-hmm. Listen, I'm not involved in that. You're not. Our PTs aren't. The surgeon. Guess what? Surgeon is the leader at that time, right?
Yes.
Then it's post-op. That's not me or you either. That's our PT. So then PT comes the leader of your plan, but she's still communicating with the surgeon. Then it becomes, hey, let's do some more soft tissue work. Maybe I become the leader for a little bit. Then he goes back to PT and then back to you. So you see how at any given time there's a leader, but those leaders are communicating. It's kind of continuity of care. And that's what at my office, or that's what my business partner tried to do years ago, was be able to bring that together without a bunch of egos, right? Mm-hmm. Because you have to be able to check your ego at the door, because a lot of people will be like, oh, Achilles rupture, and then they'll try to do shit chiropractic rehab on it. And I'm like, dude, you weren't trained that way. I don't care how many weekend courses you took. A physical therapist is better at post-op rehab because they had clinical rotations. They had all this kind of stuff in school that we just didn't have. Now, I know a lot about it just because I'm in that setting all the time. Mm-hmm. But I wouldn't feel comfortable taking on a case immediately out of surgery for an ACL, or not an ACL, an Achilles tear.
Right.
So that's where you have to be able to put your ego aside and go, listen, I'm not great at this. So listen, you're going to go and you're going to do your work here. And you know what that does, though, is it creates such trust in the patient, client, with you, that you have their best interest in mind, right?
Yep.
And that's the thing that will make a patient or client forever, because you're giving them quality advice and you're dictating that, or you're moving them through a healthcare system that can be very confusing at times, and really helping them go through that,
Yeah, I think I'm pretty good at math, but I don't do my own taxes, right? Like
Exactly.
Like there's so much overlap between all of the separate professions within the sport. Medicine.
Wait, brand placement. Sweet. It's my office right there.
Everybody see that?
Everybody see that? Like, just put it on the background right here. Sorry, wait, that was interrupting a very important thought, and I'm placing my business in the background.
Feel free to plug it, man.
You probably lost your train of thought too, man. See, that's so rude. I've been on the end of this, I was used to, I didn't do a lot of these for a while, and it was always me hosting the podcast. We did about 35 episodes, and then I'm kind of like, I need a break, because it's a lot of work, man. So I really appreciate you doing this, creating outlines, doing all that. But
for sure,
it's kind of nice when I could just see what you're doing and throw a wrench in it every once in a while, because I remember when people used to do that to me. So I might come back with the podcast. I'm not sure. It's just a matter of me getting into it again. So, but you're doing a great job, man. So see, go for it, buddy. Keep going. So what was that thought?
So,
wow.
It's all good. So, just saying, like, there's so much overlap between just the content the like biology, anatomy, physiology, kinesiology, like we're all learning those things, everyone in the sport medicine realm, but you're still kind of in a slightly different lane depending on what profession you're in. So yeah, you gotta, just because like I feel like I know joints pretty well, but I'm not gonna try to manipulate them.
Right. Well, it's like a PT. They learn that. They learn that, but there's like one class, right? We've taken it for, a whole year or more in school, so many hours, and that's kind of how at the office how we go back and forth with patients too. You don't want to redo work either. If I come back and say, hey, I worked on this, this, and this, and we do that with the patient we've been talking about, right? I'll work something at the office, and then I'll be like, all right, go tell Kevin did all this stuff, right? And it's kind of, why would I redo your work, And so I feel like that communication between providers is important too, because you'll see some of these places that pop up all over that say they're multidisciplinary, but then the providers never communicate, and then they're just do patient hoarding, and they're just like, oh, I know it all, but they might share office space. That's not the same thing I'm talking about. I'm talking about actually walking a patient back and going, hey, I just did this, this, and this. How many times do you want to see him? Here's what I'm doing. What can you do that's complementary to that? And how can we kind of team up on this? So
yeah, when you can do that, the outcome is just, it's so much better. Like you get to goals faster. The adaptations are more profound. They're more significant. The risk of potential issues along the way goes down because now you have multiple people with slightly different areas of expertise.
And you never really hit that plateau where you just end up treating from weeks at a time and not getting any results. It's almost like, man, I do one thing once and I don't get the result that I want. I'm already searching for other answers in my office. I'm like, hey, what else can we do? Remember that big bucket of modalities we talked about. Some people respond well to dry needling. Some people respond well to cupping, to massage. And it might change, so you can always change those kind of things up too, and find somebody that's really good at it. Because in my office, everybody kind of knows how to do everything, but it's like there's certain things I'm really good at or that I really like. I just come from a baseball background. I love shoulders. I like everything, but shoulders I just have, I don't know, you get an affinity for, or you've seen a lot, and everybody's kind of got that in the office. So I'm not ashamed or afraid or have too big of an ego if a patient comes in and goes, hey, I have this problem. I'm like, you know what? I have, Dr. Kip's right here, or Keisha's in PT. I'm like, they are really, really good at this. I'm going to have you see them. I'm not your team leader right now. They're going to be, so that's huge.
Yeah, like you said, like that builds so much trust. And ultimately, if you want to be successful at business, you're going to get more referrals if you're building trust and getting like high quality outcomes than like trying to hoard a client and just like, no, I'm going to hold on and I'm going to extend out how long I see them and how many sessions I get with them. It's like I don't even try. Like I try to work myself out of a job as much as 100%. I can.
Right.
And most of the time that ends up not really happening because then, the injury prevention turns into, sport performance training, which turns into working on their nutrition, which turns in, and like,
you can't do it all. Well, you can't be a jack of all trades, master of none when it comes to that, Exactly. And that's the biggest thing that I'm trying to, I try to teach any new chiropractor that comes and works for us, or with us, is that use your resources. Because I think chiropractic as a profession comes from that whole patient hoarding thing, right? And the way I look at it is that if I can get you to the right person in my office or whoever, it opens me up to change, to see somebody else, right? That's what I look at it as. Is okay, I got them to the right person. Now the right person is going to come into me, right? It just keeps coming around. And it opens up my schedule. Hey, guess what? I don't need to see that patient anymore because they're getting care over here. So guess what? Now I can spend more time with somebody else that needs me as the leader. Yeah. And if you look at it that way with that mindset, is you can help more people that way, right? Instead of you just being one person, now you just helped. If I referred somebody to PT or another one of my docs or that kind of thing, okay, I just helped 5 people in the matter of time that it takes me to see one or help one person, right?
Yeah.
That's kind of the thing that when I started the podcast that we did for 35 episodes. I think I even told you this because you were a guest on that show, man, 2 years ago. Was that I can only help 20 people a day, but if you can get the word out like you're doing right now, you can help thousands or whoever downloads it, or you're going to help a lot more people. And I think at the end of the day, that's what we're all trying to accomplish.
I'm hoping for thousands.
There you go. Hey, hope for 1 million. Yeah.
One day. But yeah, that's the thing. Like when you remove yourself.
Maybe a talk show with those good looks. That's it. Hey. That's it.
I don't know how much longer they're gonna last, if at all. If I actually have, I get stopped probably.
If you shave that beard off, you probably look a good 12. Just like a good 12 or 13. That's it. You borrowed your dad's podcast equipment to do this. That's it. They'd be like, "Who's the YouTuber?" my
fit in with
my 10-year-old would be like, "Dude, there's a great new YouTuber. He's like 12 is my age."
All the 12-year-old experts on YouTube, man, they're killing it. They're raking it in.
I'm waiting for like the 15-year-old life coach. The 15-year-old. Those are the best, right? Or the guru. I'm exaggerating a little bit. There is the 22, 25-year-old life coaches, which is pretty comical to me, but oh well. Not to blast on them.
Cracks me up, man.
I know. What are you gonna do?
I get told every once in a while that I look like Adam Levine.
Oh well, hey, not a bad thing. Not a bad thing. You break out the abs in the show then?
I usually don't.
No,
and no tattoos. No. And I can't sing, but
it's a good Halloween costume. Let's put it that way. Right. Maroon 5. You take the band with you.
Exactly. But that's crazy stuff. But yeah, anytime you can remove yourself as a bottleneck, it's a good thing. Frees you up.
100%. I'm going to use that actually. That's pretty good. That's going to be good into the training, into our systems, is remove yourself as a bottleneck. It really is. It's good. Maybe that should be the title of this podcast. I always used to, when I never had a title figured out, and then all of a sudden somebody would say one liner, and you're like, yeah, that's the title.
That's it.
You came up with it. Remove yourself as a bottleneck. There we go. Cool, man.
So let's talk a little bit about where it's appropriate for someone like me to refer one of my clients or one of my athletes to either a chiro or to a facility like yours that is a little more multidisciplinary.
Again, if it's a co-treating situation, then there really is no bad time, right? I get a little leery about, again, it goes back not to bash on the chiropractic as a profession, but when you refer to a chiropractor that's got like family practice, sports medicine, wellness, all this stuff in the title, I'm like, you don't even know what you are. You're just trying to grasp at everything, right? So it's almost like, find, you've been doing it long enough too that you kind of know, okay, well, this might be a good modality or good something. Just get another set of eyes on it too, right? Mm-hmm. I really don't think there's a bad time, but you just got to find the right person or the right facility or the right situation. So even when one of my patients are traveling out of town, or they're moving, they're like, hey, can you help me find somebody? And I'm more than happy to do that because I can, they send me the website. I can pretty much sift through it pretty quick for them, and kind of go through it. But, what you want to look for, I guess, if you're looking is, making sure that they're really specialized in their, say you're a runner, right? You're an athlete, that they really do treat athletes. They're not just throwing that sports medicine, wellness, that kind of thing. And then you're going to come in and they're going to say, well, I need to see you 3 times a week for the next lifetime. And you're going to go from there, right? And if you hear that as soon as you walk in the door, leave. I'm telling you that right now. Where they kind of give you the whole sales pitch and they want to shoot x-rays right away. How do they know you need x-rays? That doesn't make sense. Like, did you do an exam even, Or they're giving away $10 x-rays. Like, who gives a shit? Like, what's it going to tell you? Like, don't go waste your $10. That just it sounds like a good deal, right? Make sure that there's a rhyme and reason for what's going on, and not just this whole thing like you want to get signed up for a gym membership in your healthcare. It just doesn't go. So, I guess long story short is if you go into a place and all of a sudden it's this whole sales pitch, just leave. I've seen so many people burned on that where they're wasted $2,000-$3,000 and they didn't get any better. They just like, I went 3 times a week for 6 weeks and I'm still sore. And I'm like, dude, I've never treated anybody that long and never gotten results, you know? So that's the number one thing. But as far as for the referral, you know, you build your network. If that's speaking from the patient's perspective, from the provider's perspective, like you and that kind of thing, I think it's build your network. You know, build your network of, oh, okay, I got so like I do with orthopedic surgeons. I have guys that I can text message. I have a patient, can you get him in today? You know, like that's the kind of service you want, and that's the kind of service people are expecting now. You know, and it's the same thing with my players. They have my cell phone. They text me. That's the difference between being a true sports medicine practice and just saying you're doing sports medicine, because it doesn't really stop. Like it doesn't. There's a text message all the time. I heard that. Hey, what do I need to do for this? It's because their livelihood depends on it. They're getting paid millions to be able to be right, and it's stressful when they get hurt and they can't do what they want to do. So I guess it's an all-in thing, and you got to look for the person that's willing to do that. And I think I have it right here. You said a little bit of an outline, and this was kind of for, well, let me pull it up, for later. Oh, I don't have your outline here. Let me see. Oh, there it is. So you were asking for a piece of advice. I mean, and this kind of led right into this, is care. I mean, that's the number one thing. I mean, I think I wrote a quote like this. I kind of try to put, you know, kind of quotes out on my personal Instagram story, but also not just quotes, but like useful information quotes, you know? And I think Gary Vee said this, and that's where I got it from, is that caring is your most valuable marketing tool. And if you truly care, you'll build a business, you know, and if you put that first, that's the biggest marketing. And like, you go back to that patient we share, even though I give him shit all the time, he knows I care so much about how he does, how he feels, how everything goes. Right. Yeah. And so we have fun with that, but at the end of the day, he knows I care and care more than most, you know, because and that's finding that in your office between our PTs, our chiros, they all care like that, you know. They all have, patients have cell phones, you know, it's the difference of going that little bit extra mile to help somebody out.
Yeah. It's really nice. I love this sort of profession, because even though it's my job and I have to be professional, I still get to be super invested in my clients' lives, and I get to I get to rib them while they're here. I get to joke around with them, but then, you know, I also know what's going on in their life. And what you were saying about care, that just reminded me of the quote. People don't care how much you know until they know how much you care. And like, you can have all the information.
That's a tongue twister, dude.
Yeah,
I saw it in your eyes too. You were like, I was like, I have to get this right.
But like,
that's great.
You can have textbooks memorized, but like, if you're just like cold and you like, this is a personal business. You have to be able to interact with people every day, and you have to invest not only in them, but you almost have to entertain them sometimes. 100%. And if you can't do that effectively, then they're not going to continue to see you. Even if they are getting good results, they're just like, oh, that place sucks. So I think you're spot on right there, man. Like, when people know that you're invested in them, and that you're able to check your ego, and you're able to say, you know what, hey, I'm gonna have you work, you know, today on this with the PT or this person, then they're like, oh, okay, he's not just handing me off. He's giving me the best option right now for me.
And that's kind of the talk track that we use with patients too, is that, I mean, I'm the first one to say, I don't know this as good as they do. And being completely honest like that. And then that just builds trust, shows me care, everything you talked about. So I think if we sum that up, that best piece of advice is just care. I mean, think about that though. That applies to business across the board. You know, I mean, even a CEO that cares, he's going to get the best results from whatever he's trying to sell him, and he's going to get the best results from his employees too. You know, so I think Gary Vee had that dialed in when he said that too. That hit home when I read that a couple years ago. It was in one of his books. I forget which one, but he's got a couple.
Yeah, that's solid stuff. So Can you tell us a little bit about some of the other stuff that you're learning right now, or researching and working on?
The biggest thing for me is we have an office down in Midlothian. And again, I there's a place down there called Outlet that's really close to that. It's kind of a big, if you will, it's a Exos, MJP, those kind of places. It's a big, field house. But there's two guys down there, one that runs football combines, Ryan Menzel, and then Brantley Freeman that does baseball. And I've just been really it's baseball season, so I've just seen a ton of pitchers, and that they gravitate to me. I like shoulders. We do all that kind of stuff. So I guess the thing I've been really learning lately is just taking, and this is again how I'm implementing multidisciplinary, not just PT, MDs, all that kind of stuff. But he's a pitching coach, and so teaching him and him teaching me on, think about how a coach tells you to do something. They're just like, do it. And they're like, do it again, do it again, do it again. What if you physically can't do what they're telling you to do? Mm-hmm. Right? I'll give the example, not to get too, I don't know, I guess we can get technical on this. Why not?
Get technical, man.
For example, when we're looking at a pitcher and he doesn't have his velos down, he's got that dead arm feeling. I've learned this from Brantley from a technique perspective, he's probably collapsing his lower body. And then what ends up happening is, we go through like some Thomas Myers stuff with anatomy trains, is then you start following the lat, teres major, lower, long head of the triceps into the ulnar collateral ligament. And what do most baseball players have? Elbow pain, right? But it all started with a pitcher collapsing his back hip because of his QL being tightened and not engaging his glute and his TFL.
Wow.
So when that collapses, you immediately lose velo, and then to get that, you're forcing your arm into extension. So you look at it this way: you can have these rotator cuff problems and these elbow problems. That's not even the problem. You're collapsing your back half, and it's all coming because you're not having proper upward scapular rotation. And for those that don't know what that means, it means when you put your arm over your head, your scapula should rotate up. So if this is your scapula right here, I don't know if you can see this, but it's rotating up when you put your over, right? It needs to glide. And most pitchers, they'll be sitting with one shoulder lower when that lat's locked up. So it's just kind of that fascial line, that muscle, all the way up to that tricep, right into that elbow. And if you look at anatomy trains, you'll see the common fibers between all those, right? It even goes all the way down into the flexor carpi ulnaris, down into the pinky finger, that muscle that controls that, right? And those all have attachments into that ulnar collateral ligament. So long story short, if you can fix the technique, Brantley could teach you how not to collapse. We can work on getting the hip right and work on that tissue. Then you're never going to have that elbow issue. No, not saying never. Because if you throw hard enough, something will happen. But that whole chain is fixed, so we can actually do some injury prevention on that. So we've been working on that all baseball season, just kind of analyzing a lot of baseball video, and then me getting him the information he needs and being like, hey, you can't just tell him not to collapse. Like, there's an issue here. So me being able to fix that, give him homework assignment to help fix that before he throws, and then he can kind of go, okay, now we know. And that also puts his mind at ease, like, all right, the body's right. Now they should be able to do what I need them to do, right? So that's an example of how a performance coach and a sports medical provider could work together. Not just for injuries, but injury prevention. It's kind of funny because him and I will have this ongoing thing. Once a week, I'll text him a video of a kid, and I'll go, guess where he hurts? And don't give him any other information. He looks at the video, and 9 times out of 10, he'll text me back and he's like, I bet you his anterior shoulder hurts because of this. And so it's in baseball too, there's two schools of thought. A lot of rehab specialists will just look at the arm. Now it's, especially pitchers, it's that lower body really has a disconnection between the arm, and if that's not linked up right, then you're gonna always have elbow stuff. So it's kind of like that whole adage is sometimes it is where it ain't. A kid comes into me with elbow issues, I'm like, it's not the problem. Or not the source. It is a problem because it hurts. And so you have to have some of those modalities to kind of make them feel better, dry needling, all this kind of stuff to kind of take some of the pain away, which that pain is very real. I'm not saying that that's not the issue, but your why, right? Your why is that kinetic chain of a thrower. You have to fix that kinetic chain, or that elbow pain is just going to be, it's like going in, ART, just why you're going to go and smash the elbow around. Well, great. It's going to make it, the tissues are going to be more pliable and free. As soon as you go back and throw 50 pitches at your normal thing, it's going to keep coming back.
Yep.
And then the elbow stops hurting, but then now you have a torn labrum. So it's just one thing after another. So again, it comes back to finding your why.
Yeah, I think it's so important to understand like athletic movements. Like you have to know what the quote unquote ideal should look like, and then understand that there's a lot of variation, individual variation. But if you don't know in general how things are not only attached, but how they work together, how they work in opposition, then it's going to be, it would be impossible for somebody who doesn't understand that, you're generating force with the lower body, and then that you're transferring that through the torso, and then ultimately it ends up, with the release of the ball at the hand. And it's throwing, especially pitching, it's a total body movement. And like when you understand all the, and I hate to say steps because maybe that breaks it down too much into these separate movements. Like it's essentially the whole body moving all together. And when my mentor Ambrose, he says, if you start wrong, you're going to finish wrong. So if that leg is collapsing,
there's interesting. I have one lefty right now that Brantley was like, dude, as soon as he steps on the rubber, he loses velocity. So I mean, because as soon as he steps on the rubber, he collapses his back leg. Even just the way he's a tall kid, so he just kind of like 6'6" or something. So he steps on the rubber, he immediately bends his back leg, or it collapses his whole back half. So that's exactly it, right? Even if he's not starting right, how the hell is he ever going to finish right?
Yeah, you can't fix it halfway in between, especially with something that is, you're generating so much force, and speed is a huge component. Like you can't course correct in the middle of something where you're doing it max effort, essentially.
Right. So, well, and it goes back to that same thing that I think that post that I did today, I talked about a medical diagnosis versus a mechanical diagnosis, right? Mm-hmm. You can have, we'll just use the elbow, for example. You can come in and go, well, my medical doc, my ortho told me that I got a strained ulnar collateral ligament. I'm like, great.
Cool.
I'm like, yeah, that's a medical diagnosis. Mm-hmm. But now we're going to find the mechanical diagnosis, which is usually your why. Again, I think the post I did today was about plantar fasciitis. It's like, yeah, that just means pain in the bottom of the foot. Like, okay, that's a medical diagnosis. What's the mechanical or movement diagnosis that you need to look at?
Yeah, that's actually, I love that whole idea of differentiating between those two, because like I'm not a doctor. Mm-hmm. I can't diagnose an injury.
Right.
But it's perfectly within my scope of practice to diagnose issues with movement.
100%.
Like as a student and practitioner of biomechanics and like applied kinesiology, athletic movements, I have to be able to assess in real time, or sometimes like if I'm doing an assessment, I can do, record it and see it in slow motion. I have to be able to say, if a client comes to me, hey, I've got knee pain, I've got, the ortho said I have this. And that's, like you said, that's the medical diagnosis. I'm like, cool, that's useful information because I know where you're experiencing pain, but it's not my job to treat your pain. It's
I guess the big thing I've learned with that too is you just got to be careful with that, because you and I would get excited about, oh yeah, let's find that mechanical. You have to make sure that when you're talking to that person, you really sympathize with that they are in pain in a certain area.
For sure.
And that it's not fake and it's not coming from somewhere else. You have to be able to, let's backstep a little bit. You still have to treat the area of inflammation the correct way. You still, at least from my perspective, right? And that's where maybe that's a referral for you, meaning that, listen, you're going to handle the mechanical stuff, but I need to send you to somebody to kind of put the fire out on this elbow, that kind of stuff. So that goes back to your original question about when to refer, when to diagnose. If there's an active inflammatory condition or there's something going on there, then we have to really address that, because then at the end of the day, if they're in pain, they're not going to be able to move good anyway. I mean, they're not going to be able to do what you say. So you have to calm down the pain of what their medical diagnosis is, so that they get pain-free to be able to, so they'll be able to show you where their movement flaws are.
For sure. Yeah, with the majority of my clients, because they are primarily triathletes, endurance athletes, a lot of runners, a lot of cyclists and swimmers and stuff like that. I also work with a lot of youth athletes, but most of the time here in Dallas, when I'm working with an endurance athlete, they're coming to me because, maybe they don't yet need to go to a physical therapist or an ortho. They're just kind of in, they've got these nagging pains.
It comes back to the same thing though. That you can go to a physical therapy clinic where they stick you in the corner doing knee extensions.
Yeah.
They'll mail it in too. I mean, it's there's good and bad of everything.
For sure.
So at the end of the day, I mean, that's what I mean behind what you have behind your name. If you're doing the correct things, and it doesn't matter, it really doesn't, So, so that's kind of it on that, really. I mean, as far as, again, keeping those egos down, I don't care what you have at the back of your name, as long as you're getting the job done, So.
For sure. Yeah. But yeah, I can do some passive assessments, some active assessments, and, if they've got knee pain, after a few active assessments, I can usually tell, like, oh, okay, well, the knee pain is coming from this knee collapsing medially because, your arches are collapsing, and, on the single leg squat test, like, it's pretty easy to see, like you said, you could send a picture or video to that buddy of yours, and once I explain to, the client, like, if this is going on and the knee's going way past your midline this way, and it needs to be staying out this way, like, does it make sense that you'd have pain on the inside of your knee? And they're like, yes.
Yes, it gives them objective data that they can actually go, man, that's why that hurts,
Yeah.
So. And
then that's also really useful feedback for them, because then when they go for a run the next time and they start to feel a little twinge on the inside of their knee, they're like, oh, okay, all right, I know that, my glute med's probably fatiguing a little bit. Maybe I should, cut the run down now instead of trying to push through and get another 5 miles.
It's education too. You become a teacher.
Exactly. Exactly. That's so important. If you're not educating your clients and trying, like, again, I'm trying to work myself out of a job.
Yeah.
I want my clients to understand what I see as much as possible. And because, maybe I get to see them once, twice, 3 times a week. They're training probably every day. So they need to be able to know a lot of what's going on, because, if they're trained for an Ironman and they're doing, an hour swim followed by, an hour or 2 on the bike, and, I can't be there for that. Like, so they got to know, at least to some degree, the practical application of what we're trying to do in here. So, but yeah, that's crazy stuff.
Good, man.
Yeah. So what do you guys do with regards to nutrition?
Right now we don't have a nutritionist. I refer out to that.
Gotcha.
It's just one of those things. I enjoy nutrition. I enjoy talking about it, but there's only so many things you can do. Like you said in the beginning, you don't want to water down everything. So I'm like,
yes.
You're there to see me. I know what I'm really, really good at. Even though I might like talking about nutrition, I can give you a couple cool tips. But there's other people out there that, even in the Metroplex here, that I kind of match up personalities. Is usually how I refer out, to say, oh, this patient kind of get along with this person, or have this lady that, this is a young girl, like she's experienced that kind of stuff. So that's how I kind of, when I got out of the triathlon coaching business, that's kind of how because people ask me all the time, like, you still coach? And I'm like, no, dude, no, I can give you advice. I'm coaching everybody when I'm in here. I can help more people. Again, it comes back to that thing is I can only coach 5 people at a time, but I can help, give advice. I'm the same way though. I've been doing it long enough that if somebody comes to me and goes, hey, I need a coach, I usually have a list of, oh, okay, you probably get along with this person, So that's kind of what I do with nutrition.
Gotcha.
Depending on what their problem or issue is, I have a couple people that I kind of like, okay, you'd be a good fit.
Yeah, no, that's awesome. Because again, that's one of those, I've seen chiros who, especially the ones who have every single subcategory listed, like I can do everything. Oh yeah. Right. And nutrition and, buy my vitamins and
yeah, exactly.
Yeah. So, but that brings me to another thing. So can you tell us a little bit about your supplement line?
Yes. I'm, unfortunately, one of the biggest things, and this is what I've been thinking about today, is I even sent an email out, is I want to get it NSF certified. And it's such a it is a scheme, I mean, because the place that a scam, I should say, it's because, the place that my supplements manufacturer, I mean, it goes through the same kind of testing that they go through, but I understand that there's kickbacks and all this kind of stuff that if
you got to pay to play.
That's exactly it. But anyway, so my own supplement line, I mean, I don't recommend that my professional athletes take, because I don't want to ever be responsible for that. But I did try to concoct a very good formula of natural supplements, so right now we carry BCAA. Basically what I use, I really believe in BCAAs, a powder for right after workouts. I tried to do one that took out all coloring, all artificial crap, all that kind of stuff. We do as natural pre-workout as you can kind of get, it's colored, flavored with beetroot stuff, and doesn't have, again, all the coloring and everything. And doesn't amp you up too much as far as artificially, it does have some caffeine, coffee bean kind of natural sources. So it's a really good, I mean, I use all these to this day. We have a joint formula that helps support joint health. One of the biggest things is you go to Costco and buy $10 worth of 1,000 glucosamine tabs. There's a reason why they're only $10, right? They don't really have, and you'll know this, they just don't have a transporter in them, right? And so, we have that, electrolytes, electrolyte pills in this time of summer. I mean, I think I did a post on that not too long ago, is that you can, without getting all the sugary drinks and stuff, because here's the thing, people are like, I drink enough water. Well, you can dehydrate yourself by drinking a lot of water. You just basically pee out all the good stuff, and then you're in trouble, right? So, in this heat, especially when I'm training, I'll take 2 salt tablets in the morning with water, just so I don't have to drink those sugary drinks and everything, and it kind of sets up my day. So I kind of do that. That's why we have those kind of products. We that's our line right now. We're kind of seeing how they do and kind of working on some other things. But like I said, I kind of pivoted and kind of started doing some research on how to get the ones we have NSF certified. Still haven't gotten an email back. But, I'll have to send another one just to see what it is, because I'm sure it's dollar bills is what it is. So I just gotta write. I basically email them to see where they want me to write a check to. Is what it comes down to. But
gotta grease the wheel.
Right. So but there's every supplement that we kind of come up with and go with is stuff that I use on a regular basis. So
Gotcha.
Great products again. But just to be on the safe side, and this is going out to anybody listening that does treat professional athletes. You gotta play by the rules. And you never want to be responsible for giving them something that isn't NSF certified, because that's what the first question they're going to ask. It wasn't on the list, and if it's not on that list, then they're in their meetings, they're told not to take anything else that's not on that list. So you don't ever want to be responsible for that, even though it maybe as clean as anything, but there could be contaminants, and then all of a sudden it's nobody's fault. But guess what? You told them to take it, and now there you are. So you don't want that reputation.
For sure. That's the truth. So the one thing I really like about your line is you're picking like specific ingredients that aren't like sexy. They're not the ones that are like trending right now that everybody's like, trying to buy off the shelf, because it might not be here in 3 months.
Well, I mean, the salt tablet, all it has in is what you lose in a half hour's worth of sweat. Like that's all that's in it. Like nothing else. Formula is literally you can Google in what do you lose in 30 minutes of sweating in outdoor activity or something like that, and you will get the exact ingredients. It's basically that, So yeah, we did try to do that for sure.
That's good. It's good stuff.
BCAAs taste really good. I don't know. They do. They really are a good flavor. So
yeah,
I enjoy it.
Well, that's one of those things that fairly recently in the industry, like in the sports nutrition industry, BCAAs have like, for some reason, everybody's like taking a huge dump on them and saying like, this is crap. We don't need this. If you're getting enough protein in your diet, then you're wasting your money. And I'm like, exactly. Who gets enough protein in their diet?
Well, practically, I can tell you how it works. I mean, if I'm done with the workout, I can honestly tell you, if I slam 1 scoop, 20 ounces of water, it helps me not be starving. So I can basically go home, and I use it as basically, I mean, like you said, I don't necessarily know if we need all that much, but I know what it does for me. It allows me to finish a workout, have that, be calm, and make right decisions about my diet. Because if you don't, you're starved and then you make bad decisions. So you can see how by taking a supplement, you can indirectly help your diet, even if you might not need all those nutrients, but it's helping you make better decisions. And that's how it helps me. Yeah. So again, it's kind of, man, there's these, you get these Instagram fights with all these guys out there. There's this one dude that him and this other scientist guy, like one guy, it's like one guy that invented the Bosu ball, and then this other guy's like some scientist from SMU, and they just battle about nonsense. And I'm like, at the end of the day, though, the guy that invented the Bosu ball that's kind of just telling you, hey, this is how it feels, this is how it works, he makes more sense to me. Because the guy that's spouting off all this science, I mean, granted, science is cool, but it's not practical at some points. He's just quoting studies. I mean, and this is kind of the same thing with this. Like the BCAAs help me make better decisions because they calm my appetite down so that I can make better decisions. That's what it does for me. So when people ask, well, why are you taking it? That's why. I mean, who knows if my muscles are getting opened up enough to absorb the BCAA? Like, I don't care.
Well, that's the thing is, the research is very clear. Like BCAAs stimulate the synthesis of new muscle protein. Are they as effective as like a full meal with a large bolus dose of protein? No. But immediately after training, can you eat a giant meal with no, like you're trying to get something as soon as possible. And for athletes who are notorious for having bad diets, I still think BCAAs are a really, really, really solid choice for most athletes and for a lot of people in general. Like, yes, in an ideal world, everyone exercises, everyone gets 8 hours of sleep, everyone spends, an hour or less looking at their phone screen, and they have a perfect diet. But we live in reality, and there's things that you can utilize to make life better, to make your training better, to make your adaptations to training better. And
for your OCD triathletes, what I used to tell them when I would coach is that when you get done with a workout, think your muscles like, a big sieve. And the holes in the holes, like, the spaghetti strainer. Imagine your muscles like that, and the holes are huge. So as soon as you get done, they're at their largest. So the longer you wait to put that's the optimal time to put something in your body. The longer you wait, the holes get smaller and smaller and smaller. And if you wait until they close all the way up, guess what? Now you're not absorbing the workout you just did because you didn't put the right nutrients in. So you have more, you're not going to recover as well. You're not going to feel as well for tomorrow's workout. So immediately right after, or when the holes are the biggest, when it's going to get in your system the most, get in the muscles the most, and feed those muscles. So they kind of got that when I told them that their workout's going to suck tomorrow if they don't do that, So you might not be able to train tomorrow. Oh yeah, I can't log something. I can't put that in the log. The best one is too. I used to schedule massages for them so that they can log it in their Training Peaks account as an hour of training, just so that they would do it. This one guy, he would never do it, so I'm like, okay, dude, it's a workout. I'd put it as other, label it as other underneath the training thing. But I'm like, yeah, if you don't get it to turn green, you know how they're color coordinated or whatever. I'm like, you got to turn that hour green. If it's red, I'm going to see it, And so you got to it's like children, like children.
That's so funny. So type A, gotta like.
Oh, I know. Yeah, I gotta get that massage now. That's part of my workout.
Yep.
I could log it as an hour of training and brag to my friends that I've trained 20 hours this week.
That's so funny. Shoot. Goodness. Well, I think we're covering a ton.
Yeah,
anything else you wanna?
No, man. It's way
you wanna
past
throw
my
in?
No, man. I mean, I think we covered a lot. I have. So we kind of mentioned a couple books. We talked about Thomas Myers, Anatomy Trains. That's Hugh Falzoni's book, Awesome, Bridging the Gap. I have one more that I'm kind of going over now that really kind of puts together. It's a little more sciencey, but it's still pretty good. And it's this one right here. I'll tell you what it is. But it's Sports Injury and Prevention and Rehabilitation, Integrating Medicine and Science for Performing Solutions. And each chapter is written by somebody else in the industry that's an expert at that. So in what they do is they cover again, the kinetic chain behind it, they cover an injury, they cover how to kind of exercise through it. I mean, it's just a bunch of things. They cover everything. They'll cover every body part in there, and it's really my go-to because it's not just a textbook of what an injury is and explaining the science behind it. It's actually what what you can see, what you can do about it. So those are the 3 at least sciencey books that I kind of have always at my fingertips, because I will always refer back to those. So
yeah, that's awesome.
But that's it,
Sweet. Well, how can people contact you? How can they follow you? How can they?
Yeah, so we have so our website is recoverwithpurpose.com. Our Instagram handle, which we do most of our content on Instagram, I do too. So it's Recover with Purpose on Instagram, and my personal one is just my name, Ron Tribendis, and on Instagram. Gotcha. Those are the kind of the media that we use. The past podcast episodes are on our website. We have everything kind of listed on there, so you can really find out a ton of information just from going to our website.
Yeah, I think that one episode you did on like protein, I think was pretty awesome. You had some guy on there, Kevin Coon.
I had Adam Levine on there talking about protein. that broke. I got like 10 million views or something like that, because he did it with his shirt off. So that's why I recorded it. So all the ladies will learn about protein.
I'm about to check one out.
There you go. There you go.
Cool. Sweet.
Awesome, man.
Thank you so much for taking the time. This has been awesome. And we'll. It's
always good to chat with like-minded people and kind of just bouncing ideas off us and stuff too. So I hope we deliver some good content for you guys out there. Thank you for having me, man.
Definitely, it's so nice having people that are within the Dallas Fort Worth Metroplex that you can refer out to and stuff like that.
There's a lot of good people here, man. We are lucky, very fortunate to live where we live, because while there is competition, that breeds very good results and has everybody up their game. So,
and there's enough business to go around.
Everywhere there is, and that's always the case. It's just we have everything at our fingertips here. So you have no reason, if you're hurt out there, to reach out.
Mm-hmm. Sweet. Cool. Alrighty, Ron. Well, I'm sure I'll have you back on again in the future.
Let's do it, man.
Yeah, we'll be able to talk about some more fun stuff. So
everybody, I appreciate you, man.
Hey, thank you so much.
Hey, all right, everybody. Take care.
Definitely. Everybody, stick around for the next episode. It should be up in a week or so.
And he's going to bring the band out with him. Maroon 5 is performing. Next episode has Maroon 5. You got to tune in.
Later, y'all.